Allergies and asthma tend to develop as you age, and it depends on the person. 3 to 7 years old, you'll start to develop other problems, which is most common. It doesn't have to go that way, but allergies and asthma definitely go together. If you have one, it's more likely that you may have the other. So there's some people that have asthma that's triggered by allergies. So if you have allergic rhinitis and allergies to things in the environment, it's not uncommon that that same exposure, so let's say you're walking through a field that was just cut and you have a grass allergy, that your asthma will flare. Or you have a cat allergy around a cat and you have, again, the flare of your asthma symptoms. Those symptoms will be shortness of breath, wheezing, maybe chest tightness, the sensation that it's difficult to breathe. Asthma is really kind of a two-pronged disease, meaning you have both constriction with the muscles within the airways and the inflammation. If you're able to cure both, albuterol helps with the narrowing of the airways. And for people that have bad asthma, if you need to help with the inflammation, there's inhaled steroids, and there's several that are on the market that you also will use as an inhaler. One thing that we often do in our office is do a spirometry. Spirometry is a machine that you breathe into. As you breathe through there, it is recorded on the computer, and you're able to have a good indication of what's going on within the lungs. And that's really helpful in deciding if someone has asthma or does not. What we often see is with asthma can be very difficult to treat with smoking. The smokers tend to not respond the same way as non-smokers do to the therapies that we try. So sometimes you'll need to be on multiple medications to try to get good control, or may not even be able to get good control if you continue to smoke. The nice thing about being evaluated if you are having breathing problems such as wheezing or shortness of breath or chest tightness, it's really during that evaluation that you can really help tease out what is it. Is it asthma? If you don't have allergies, it could potentially be something else that's causing problems. For any patient that comes into my office, I like to make sure I have the time and the ability to listen to the patient to make sure I understand the problem that they come to me for. And then once we determine what the diagnosis is to keep the patient engaged and try to determine what is the treatment that is going to be best for that patient. I really enjoy seeing patients and getting to know them.